Filler versus fat grafting, what is better? What should you do? Well, it depends on your face and your goals and your recovery. So let's say that you just want a little bit bigger lips, or maybe camouflage your nasolabial folds or your marionette lines. Filler is a great solution. There's less downtime, it's fast to do. We just take the filler right off the shelf, open up the package, and we can inject it in your face where you need extra volume. So for a couple small areas or low volumes, I think filler is a great solution. Now, if you want multiple areas injected, like you want your temples, your cheeks, your eyelids, your nasolabial folds, your marionette lines, your lips, multiple areas injected, then I would recommend fat grafting, because fat grafting is cheaper than 3 syringes of filler, I believe. Don't quote me on that, but in general, I tell patients if you need close to 3 syringes of filler to solve your problem, you should consider fat grafting, because with fat grafting, it's one fee for as much fat as you need for your face. Because the time, cost, and work with fat grafting is the harvesting and processing portions of the operation, and we always harvest and process more fat than you need. So when it comes to deciding between filler and fat, number one is how much volume do you need? If you need more than 2 to 3 syringes of filler, consider fat, because it'll probably cost the same, but it will last longer and you can treat everywhere that bothers you. The next thing to think about is recovery time. Recovery after filler injections is fairly quick. There really isn't much recovery time at all. Recovery after fat grafting is more prolonged. You're going to be very swollen. Well, it depends on how much fat's injected, but you will have more swelling and bruising compared to fat grafting. If we inject your lips with fat, you're going to have monstrous temporary swelling of your lips. So consider all these things when you're deciding between filler and fat. Most of my patients who choose fat grafting to their face are recovering from something else anyways, so it makes sense to combine the recovery from fat grafting to the face while they are recovering from something else. For example, if you're having a laser resurfacing procedure done to your face, or a blepharoplasty, or facelift, neck lift, any other facial procedure that creates the need for a recovery period, you might as well have fat grafting performed to your face so that you're consolidating those recovery periods. It would make no sense to have filler injected to your face at the same time as a bunch of other facial rejuvenation procedures, because we might as well inject fat at that time since you have to recover from other things anyways. So that's sort of a breakdown between fat and filler. In summary, how much volume do you need? Much more than 2 to 3 syringes of filler, you should consider fat. And if you're going to be recovering from something else, you might as well be recovering from fat injections at the same time. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.